After the age of 60, the body changes in subtle but powerful ways. Metabolism slows down, blood sugar becomes harder to control, sleep may become lighter and more fragmented. Inflammation can quietly increase, affecting joints, arteries, and overall energy levels. Many seniors begin looking for simple, natural habits that can support their health without adding complicated routines. One of the most underestimated allies in this stage of life may already be sitting in your kitchen. Cinnamon, a spice used for centuries in traditional cultures, may offer surprising benefits when consumed in the evening. The first surprising benefit of cinnamon at night after 60 is its potential role in supporting stable blood sugar levels. As we age, insulin sensitivity often decreases. This means that after meals, especially dinner, blood glucose can remain elevated for longer periods. Research suggests that cinnamon contains bioactive compounds that may help improve insulin function and slow the breakdown of carbohydrates in the digestive tract. When taken in small amounts in the evening, such as half a teaspoon mixed in warm water or sprinkled over yogurt, cinnamon may help reduce nighttime glucose spikes. For seniors concerned about prediabetes or type 2 diabetes, this simple habit can support better metabolic balance overnight. The second benefit relates to inflammation. Aging is often associated with a phenomenon called low-grade chronic inflammation. It is not dramatic or painful at first, but over time it can contribute to joint stiffness, cardiovascular problems, and reduced mobility. Cinnamon is rich in antioxidants such as polyphenols, which help neutralize oxidative stress in the body. Consuming cinnamon in the evening allows these compounds to work during the natural repair phase that occurs while you sleep. Overnight is when the body regenerates tissues and regulates immune responses, so providing anti-inflammatory support during this time may be particularly beneficial. The third surprising effect of cinnamon after 60 involves digestion. Many seniors experience slower digestion, bloating, or mild discomfort after dinner. Cinnamon has traditionally been used to soothe the digestive tract. It may stimulate digestive enzymes and reduce gas formation. Taking cinnamon in the evening can promote a feeling of lightness rather than heaviness before bedtime. Improved digestion at night can also support better sleep quality because the body is not struggling to process food while trying to rest. The fourth benefit concerns heart health. Cardiovascular risk increases significantly after the age of 60. Cholesterol levels, blood pressure, and arterial stiffness become more important factors. Some studies suggest that cinnamon may help reduce total cholesterol and LDL cholesterol while supporting healthy triglyceride levels. Although cinnamon is not a replacement for prescribed medication or medical supervision, incorporating it into a balanced diet may complement other heart-healthy habits. When used consistently in small amounts, it becomes part of a broader strategy that includes walking, fiber-rich foods, and adequate hydration. The fifth benefit is related to sleep itself. While cinnamon is not a sedative, it may indirectly support better rest. Stable blood sugar during the night can prevent sudden drops that sometimes trigger awakenings, restlessness, or early morning hunger. Additionally, the warm aroma of cinnamon mixed in herbal tea can create a calming bedtime ritual. After 60, establishing consistent evening routines becomes essential. A simple cup of warm water with cinnamon or cinnamon added to chamomile tea may signal to the brain that it is time to wind down. Over time, this ritual effect can contribute to deeper and more restorative sleep. The sixth surprising benefit involves brain health. Cognitive function is a major concern for many seniors. Memory lapses, slower recall, and reduced concentration can cause anxiety. Cinnamon contains compounds that have been studied for their potential neuroprotective properties. While more research is needed, early findings suggest that certain components in cinnamon may help reduce oxidative stress in brain cells and support healthy circulation. Because the brain undergoes important restorative processes during sleep, consuming antioxidant-rich foods in the evening may provide subtle support for long-term cognitive vitality. The seventh benefit is its possible effect on weight management and abdominal fat. After 60, it becomes easier to gain weight and harder to lose it. Hormonal shifts, reduced muscle mass, and lower metabolic rate all contribute to this challenge. By supporting blood sugar stability and reducing cravings, cinnamon may help limit late-night snacking. Many seniors struggle with evening sugar cravings, especially after dinner. Adding cinnamon to a small portion of plain yogurt or oatmeal can create natural sweetness without added sugar. This may help reduce the desire for desserts or processed snacks before bed. It is important to choose the right type of cinnamon. Ceylon cinnamon, often called true cinnamon, contains lower levels of coumarin compared to cassia cinnamon. High intake of coumarin over long periods may affect the liver in sensitive individuals. For daily use, especially after 60, Ceylon cinnamon is generally considered the safer option when consumed in moderate amounts. Half a teaspoon per day is typically sufficient. More is not necessarily better. There are also practical ways to incorporate cinnamon into an evening routine. It can be stirred into warm almond milk, sprinkled over baked apples, blended into a protein smoothie, or mixed with a teaspoon of honey if blood sugar levels allow. The key is consistency and moderation. Cinnamon should complement a balanced diet rich in vegetables, lean proteins, healthy fats, and whole grains. Seniors taking blood sugar medication or anticoagulants should consult their healthcare provider before making cinnamon a daily habit. Even natural spices can interact with medications. Monitoring how your body responds is essential. Pay attention to digestion, energy levels, and sleep patterns over several weeks. What makes cinnamon particularly interesting after 60 is not that it acts as a miracle cure, but that it fits easily into daily life. It is affordable, accessible, and culturally familiar in many cuisines around the world. Small, consistent habits often have greater long-term impact than dramatic, short-lived changes. After 60, health becomes less about quick fixes and more about sustainable routines. A simple evening ritual with cinnamon may support stable blood sugar, reduce inflammation, improve digestion, complement heart health, promote better sleep, support brain function, and help manage cravings. These benefits may seem modest individually, but together they can contribute to improved quality of life. Aging is inevitable, but decline is not always unavoidable. Supporting your body with gentle, evidence-informed habits can make a meaningful difference. Cinnamon at night may be one of those small changes that quietly supports your health journey after 60.